Have you ever noticed how Jake keeps ignoring the fact that he's balding and his hairline's receding so badly to the point where his follicles can't regrow? It's a fact that Jake has male pattern baldness that runs in his family because his dad's completely bald, and the biggest mistake that Jake is making is that he's not addressing it and not finding solutions. But instead, he's mentioned in multiple interviews that he's just gonna go to Turkey and he's gonna get a hair transplant and it's gonna be all good. But that's not the case. Unfortunately, a lot of people believe that hair transplants are gonna be 100% success rates on the first time and that there's not gonna be any complications whatsoever and you're gonna be able to keep your hair. Take, for example, this patient got a hair transplant and unfortunately his scalp got infected, leaving him with all these scabs that he's going to have to remove eventually, leaving him with permanent scarring. Even if you get a FUT or an FUE, regardless, you're still going to have to deal with permanent scarring, which is a risk you're going to have to consider. Most of my clients that come to me for a hair transplant usually have to come back a second or third time, and the problem is that the grafts aren't always going to be able to hold, and the thing is, if you're not consistent with your medication, unfortunately your hair is going to fall out and you're going to have to do the whole process again until you lose all your donor sites, and at that point you're going to be completely bald. Now, I'm not saying hair transplants should be completely off the table, but it should be left as the very last option until you have no more follicles on top of your head. If we look at the Norwood scale, if you're about at a 3 or 4, chances are your follicles can still be regrown, but unfortunately if you're at a 6 or 7, you're most likely going to have to consider a transplant. Something I started including to my practice for people who only deal with thinning hair and are not completely bald is to use something like the Folly Growth by Advanced Trichology. The reason why I suggest this to my patients is because it has L-cysteine and niacinamide. The main goal we want is for our dermal papilla to be working with our follicles and the surrounding areas, pushing away any unwanted DHT to keep our hair long. A few months back, I had a young client come to me who was dealing with male pattern baldness, who was very self-conscious of his receding hairline and all the white lines on top of his head, and he was highly considering getting a hair transplant. But I told him not to take that risk and try using Folly Growth for at least a month consistently before coming back to me. He came back a few days ago for a follow-up, and the amount of progress that I seen on his hairline, like especially on this area right here where he showed all these white lines, got me to a point where I didn't even think he was balding at all. Now, results are always going to vary from person to person, but it depends how consistent you are with this to actually see some progress. So if you're balding or you notice any signs of a receding hairline, I'm telling you, try out Folly Growth. I'll leave links so you can get one too.